Hey, Charles.
What?
We're live, Charles.
What? Are you picking me up? Okay.
We, we are live.
Yes, brother. Oh,
I'm getting all my stuff set up here. Everything is rocking and rolling. We
okay.
have my watch party set up here on Patsy's iPad, and we have mine set up right now. So I can check comments because, as you can tell, we're back on Zoom tonight
Yeah.
after. Oh, I just got a bid on my Pokemon card on eBay.
How much?
$9.99.
Oh, okay.
So that starts the frenzy of bidding. That's what I love about eBay.
Yeah.
Um, oh my God, is that her already? Jeez, she's like early. Women are always on time. Yes, exactly. But anyway, I'm gonna text her to let her know that we do I doing our dialogue right here. Hold on here. Let me find her text here. Okay, hang on. We'll bring you in a few minutes. All right. Anyway, let me get my stuff here. Perfect. That's all rocking. Comments working. Nice shirt, Uncle Charlie, is what one of the
Thank
guests
you.
are
Thank you.
saying. Nobody's
Thank
gonna say
you.
nice shirt to me because it's just a regular UH polo shirt. What kind of chocolates tonight? Oh my God. Who is on tonight? Adam is it's gonna be Councilwoman Valerie Poindexter from the Big Island. We're gonna chat a little. Well, we're gonna see what we're gonna end up talking about. First of all, welcome everybody. Again, we're back on Zoom because I just cannot deal with the technical difficulties of cannot hear Charlie, cannot hear me, cannot whatever. So we're gonna go back to Zoom for now, and we don't want to miss anything with our guests. We don't want to. We'll make sure it's an awesome experience for them as well as for you all. So yeah, so tonight we have Council Member Val Poindexter, good friend of mine from the Big Island. Big Island's going through a lot of things tonight. I just got an alert probably an hour ago. I was actually on the phone with Charlie when I got the alert from KHON that said that there was one more death at the Veterans Care Home
Oh,
this afternoon. So the count continues to rise. And then we had so we that's why we're bringing on Valerie tonight. This is obviously before the governor made his announcement today about the quarantine, and I just did want to touch a little bit about that before Val comes
yeah.
on. But you know, I was
Oh,
gonna do
please
a
share.
Facebook Live, huh?
Please tell them share. Start sharing
Ooh,
this.
yes,
Like,
that's right.
please.
That's right. Hang on. See, back to we're going back to the basics again.
Yeah.
Stop! Stop! Share this tonight. And if you have
Share.
any kids in the room, put earphones on them. I have no idea where this is going to go.
Okay,
But as
here.
you can
Share.
probably tell,
Share this. Share this
oh,
tonight.
nice. Mini pounder, premium mix arare.
This is from our brother. It's our brother right here.
Sweet lihing muy. Well, we're gonna have a food show pretty soon. That's what we'll do. You know, I'll be honest with you. After today's press conference, I
Yeah.
like transition already. We go showcase business. We go showcase products. We go show because you know what? No sense with this guy, these clowns. I'm so over it already, Charles. I'm so over it. You know, today we had talked about the maybe we should bring Val in already. I mean, but we had talked about the Senate committees, COVID committees proposal. The whole concept was to start with the inner island,
As a
the local
test.
residents.
Yeah.
That's what the plan was, right? Because Ige was all lost in space and he couldn't figure out what the hell he was going to do with the Trans-Pacific. So Senator Jarrett Kehoe Kaloli, from a constituent, came up with this brilliant idea that we were going to focus on the inner island residents, come up with a testing protocol, which included two tests, health screening before the flight and after the flight, And we're going to try that, do it as a pilot project for us here in Hawaii, so we can see if it works before we open it up to the Trans-Pacific. That's where I thought we were. The Jarrett, Senator Keho Kalole sent the letter to the governor. I saw the letter. Mayor Kawakami sent the letter. Mayor Victorino sent the letter. I saw the letters. And I also saw the letter from the governor back to them saying, this is a great idea. You have my commitment that we're going to look into this. So while I should never expect anything from this governor, I was hoping anyway that today's big announcement was going to be pursuing the inner island program, so that our local families can start going back, visiting Kupuna, Mo'opuna, Mapunapuna, you know,
Manapua, Manapua.
Manapua. I really thought that we were going to start maybe in October. Hey, go get a test before, go get a test after, and get your health screening, and then you can move freely with your ohana on the other islands. I kind of was hoping. And then, much like the press conference back in March, where I blew my first gasket, he comes out with this brilliant plan, which says now the tourists can come to Hawaii with one test 72 hours before they leave. They come to Hawaii and they free as a bird as long as the test is negative. Completely free, no quarantine. They can go rent car, they can go rent TVR, they can do whatever the hell they like do. And in the meantime, Mel cannot go visit my brother Brian on the Big Island, or I cannot go visit my friends up in Maui. I can, but I'm gonna be stuck with a 14-day quarantine. Now Derek came up with this idea about a bubble, and by the way, Timbers will be on our show on Friday night to talk about how they plan to execute the bubble, keeping the guests and the employees and everybody safe. But he comes out with this idea, which is the same idea he had back months and months and months ago. And since then, Charlie, we have had doctor after doctor after doctor,
After
even the
expert.
lieutenant governor after doctor, come on and tell us that the one test is not very effective
Yep.
because of and I don't want to go into detail, but I'm just saying we have been told time and time again that the one pre departure test is not going to catch the majority of the positive virus carriers. But he's going to go anyway. He's going to go anyway. They asked him today, what data what specific data are you using to make these types of decisions, bringing in Trans-Pacific and not Inner Island? And he said, we don't have specific data. Certainly, we we look at the numbers, and being that the numbers are decreasing, okay, the numbers went up today. We had three more people that died, four if you count the late one from the care home. This guy is wrong. And October 15th, people will on the mainland will go to CVS, get a test, get their result, and they will be on our shores quarantine free. And we all not going to be able to see our family on our respective islands, except for Oahu, of course, because of the quarantine. So anyway, Charlie, I'm sorry. I just had to get that out before we start. I feel much better now, by the way.
It's
And I ate my Snicker bar last night, so I don't even have a Snicker bar, but I do have Kit Kats and everything else.
well, don't worry, my brother. Here, here for you. Okay, that's for you.
Bring the
So
Reese's, please.
we shall bring on our guests pretty soon, but I did want to share with most of you that that there is a way that we must with etiquette we must eat a Snickers. I mean, a Reese's peanut butter cup, and it's very simple. You peel back one end, Okay, it's like a mango. You put them in your mouth and you try hook them on your teeth. Okay. Now, if you get dentures, no pull too hard because when you pull the paper, your teeth coming out too. So just take your time. Hmm? Mm-mm. Um,
I get the white chocolate Reese's.
mm.
Now, the way I do it is I hold with the right hand, and you just flip this fella down like this. Uh, uh. Hmm. Hmm.
I'm sorry,
Oh,
folks. Sorry, I'm going to eat one more in case you missed it.
okay.
Okay.
I'm gonna bring in Val
Mm, 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 mm.
because Val is there's Val.
How are you?
We're good. We're having a Reese's moment right now.
Oh, okay.
Um,
Oh,
Yep.
no.
you know, this Hawaiian is a bad influence on me, Val.
Hey, you're growing a lot of hair on your face.
You're talking about you,
I'm
Bell.
not going to shave. I'm not going to shave until Governor Ige comes up with a good solution.
Well,
Well, you're
well,
going to be Santa Claus by the time.
Val, thank you for coming on the show tonight. For everybody that does not know, Valerie Poindexter is a council member, former council chair as well
Yep.
of the Big Island. Good friend of mine. We been down the road several times together. Had a blast. I'm not gonna tell the stories of what you did to me,
And what you did to me.
but that'll be for another show. But we really wanted to bring you on tonight before we found out about Ige's brilliant idea about the Big Island. I want to chat a little bit about the Big Island. Uh, it's sad. I was just telling before you came on that I got an alert from on my phone that the care home had another death
Yes.
um,
So we're up
after
to
today's
15.
report. After today's report, so that's one big issue over there. You guys cases are climbing, and so we just kind of wanted to get your perspective from a council member. By the way, that's Charlie Iona. If you haven't figured it out, I'm Mel, and that's Charlie.
Okay.
yeah, we met each other, and I
Yes.
believe you are related to
Gabe
a
Malani.
yeah,
Yeah.
my
Yeah.
brother-in-law.
So I met you on Kauai, remember?
Yep,
Yeah.
definitely. Yep, it was
Yeah.
good fun. It was fun.
And I think Val, the last time we saw each other was in Vegas when we
Yeah.
went to that fantabulous buffet that you and your husband invited us to go to.
Yeah. You and Patsy and the kids. Yeah.
And Patsy said hi, by the way.
Oh, tell her I said aloha. Hi, Patsy. I'm always watching and looking at all the desserts and food you make. So
Yeah. Anyway, so how long you been on the council now?
this is gonna be 8 years. So I term out in December.
Uh-oh.
Uh-oh.
So what's the plan? What's the plan?
Well, the plan is I'm actually quickly we're supposed to move to Virginia. We're moving to Georgia. My mother-in-law and father-in-law had gotten COVID in
Oh my
Oh,
God.
sorry.
July, early part of July. And they went into the hospital in Brunswick, Georgia. My mother-in-law made it out. My father-in-law didn't make it.
Oh,
So
I didn't
she,
know that. So sorry. So sorry,
Yeah.
Val.
so my husband is already in Georgia because
Oh, okay.
he's the only child, and he has to go and take care of his mom. And the recovery is very difficult for COVID patients because she was out, but now back in the hospital with pneumonia. And, you don't know what's coming up and what the side effects of having COVID, we've been
Well,
seeing,
good.
go ahead.
No, I'm just going to say we have a lot of, not a lot anymore. I think most of them just stopped watching or we blocked the rest of them. But a lot of these guys still believe that, when they give the report, they say, but so many of these people recovered. Well,
No. Recovery,
Exactly.
I don't think they ever recover because I've seen a lot with memory losses, continuous lung issues. So I don't know how long the recovery phase is, and if they'll ever get to be fully recovered from this, and what the damage, neurological damages, will take place, and it only time will tell. You know, uh,
Hmm.
so
Charlie lost his brother early on. That's kind of what kicked this show off. Was Charlie? We started doing the show just to talk about COVID, and then his brother contracted the virus,
mm,
and we were on that journey with him, and his brother didn't make it either. So condolences to you and your family, and
Yes.
again to Charlie
Yeah.
again.
condolences to you, Charlie.
You.
It's such a difficult thing, and that's what is. I think that's the anxiousness about the things that we're doing to try to make it easier for communities to deal with the issues of COVID. We know that we can't wait for government to take action because some of the things, and we have communities that are very different and unique in their own ways, and how we deal with it. If The one thing I really need to bring up is the Department of Health and how they're reporting. I know on our island you have the map and it shows you where the outbreaks are. So you red, that's the hot areas, right? But then on our maps, there's a lot of gray areas. So the gray areas were areas that says NDA, which is no data available. So my question to the Department of Health was, why isn't there data available in a lot of our rural areas? And we're finding out that if that zip code has less than 1,000, the population is less than 1,000, they're not keeping data or documenting anything. So my question is, if somebody tests positive in those areas, where do those numbers go? Because it's not reported. So I'm concerned, like if it's happening on all of the other islands as well. I don't know if that's happening in Kauai, Mel. Do you know?
I don't know. I can honestly say I don't know, but I would not doubt that. I think the Department of Health, I shouldn't even say because we don't know. They're so inconsistent that it's
Right.
very hard to put your finger on anything that they say or do. So I don't know, but I would not doubt it. I would not doubt it though.
Yeah. So I'm still trying to figure that out and ask KGMB to help investigate that, and nobody has gotten answers as to why the missing communities, the rural communities throughout the island, and if you're less than 1,000, you don't count, So that's very concerning. So we're trying to push through, that tracing apps, contact tracing.
Hmm.
Uh, the Department of Health I don't think they have anything out yet at this point. So Council Member Matt Kennelly Kleinfelder and I met with the federally qualified health centers on our island. So that's Hamakua Health Center, Kohala Health Center, um, Bay Clinic, and West Hawaii Community Health Center, which are FQHCs, federally qualified health centers. Their target population is Medicare, Medicaid, and the uninsured, underinsured. Um, and talking about tracing apps, because then if the public they have access to that app, we can basically start to protect ourselves because it'll tell you where, if you're near someone that may have been in contact with somebody who has COVID. I don't know the app good enough, but I know that we need to move in that direction. And I think a lot more agencies and outside community organizations, we need to start putting our plan of action in place, because Mel, you know as well as I do, we've worked with government and it can take forever for them to come up with something or agree on something. I mean, even a council, for us to agree on, do we want to support and endorse this app, or we want to wait for more apps and see which one is best? And then we're twiddling our thumbs when people are dying around us, so we're not moving quick enough,
You,
and sometimes government gets in the way.
you know what I find that's, again, Mel and I, from way before we started this thing when it first came up. I mean, I got chastised on our own show here about, hey, it's HIPAA. And Mel came to the rescue and says, yeah, but when a shark bite you, you let the whole world know whether you got bit, what beach and all that. I said, why can't we do that? We're not asking about who got bit. We're not
Right.
asking, we just want to know the area where they were at and the time they were there. Then we can do the rest. Here's the problem I see, and I talked to Mel about this last night, and it's, especially when we had Representative Lindy Coit on with us a couple nights ago. The problem is the apps are good. Don't get me wrong. But if there's violations occurring, say for instance, the person should be isolating, right?
Right.
And the app shows them constantly, or a the person is moving from area to area, as an example. Especially with all this protesting going on, you get rules out there that says you cannot occupy beaches, you cannot gather. I don't know why they allow them to continue, because now instead of getting compliance, you're getting defiance, and this goes on and on and on. So how do you get everybody? Because what's her name last night? Heidi Suneyoshi said, basically, we're really looking for behavioral modification, and she's right. If there's a rule, let's comply, so we don't allow the virus to spread. But if you don't take action against those violators,
Right.
that's the problem. And when you get so many of them, because we know this governor is trigger happy. Today, and Mel just said it earlier before you came on, one news agency asked him about what data are you using to, open back up, what data? And he actually said, um, we have no data. So I want to know, if a big number scares you to the point, it jerks you one time that you can make a decision, then who loses out? It's the people of Hawaii and all the businesses.
Exactly. Yeah.
Because if they're saying now, going to take hotels as an example, going to take 3 to 4 years to rebound. You got all these businesses, they're at the verge where after 6 months, if you can't even give them a glimmer of hope, they're not going to exist. And we depend on these businesses. Doesn't have to be tourist related. Can be any kind of business. I mean, I was talking to a gentleman that has the largest tinting business in the United States, TNT Tinting. And he told us he has taken every single measure to keep it safe. He doesn't even come in contact with customers, and they still shut him down.
Yeah.
Yeah, so it's those kind of things. But you're right, because
And it's sad. It's sad that they pick on the businesses that way,
Mhm.
but yet when they're closing the beach parks, okay, county beach parks, state beach parks, but the private parks, they don't go after them. The private parks, you can have, like up at Parker Ranch, I had a call today saying, hey, I saw a soccer field full of kids playing soccer. Why? I thought we had the parks closed. Well, if it's a private park, it's not closed, but yet here on the businesses that are taking the right precautions and following the CDC guidelines, you shut them down. But yet a private park that has no social distancing and not following CDC guidelines, because when you're playing soccer, you're full body contact, they don't shut those down. But the government has the right to shut businesses down that are taking those precautions. So people are confused as what do they need to follow, because it's not fair for others when so
I
there's
think that's
a lot
kind
of
of
confusion.
I think that's kind of the that's why everybody's pissed off. That's why everybody's angry with anything that comes out of the states, and in some cases the counties. Anything that comes out in the way of a press release or an announcement like today, people get angry, and that's how it's going to be from now on, because they have absolutely no trust. You talked about the contact tracing apps. We all know, we have had experts from South Korea on our show. We have had people that have offered these apps that are being used in Korea as very effective, free to the state of Hawaii. It was refused. These apps would would basically help our contact tracing program, which we never had back then. We barely have one now, but the technology is there, and it was offered, and it was refused. You talk about the zip codes, the smaller zip codes not being counted. I'm going to say, and I've said this all along, that the objective of this state from day one was to open up tourism. That's what it was, Val, from the very first day. Every decision we have made was based on a date, not on a benchmark, right? It was just, we got to open up. We got to open up. they we were very light on testing and contact tracing all throughout the process, all through these last months, to keep our numbers down so we could open up the visitor industry. Now we get hit with these clusters and our numbers start to climb. So his whole plan to open up on September or August 1, September 1, went to hell because of the numbers. So they come up with this surge testing. Let's test 60,000 people or 70,000 people, knowing that it's going to drive the infectious rate, the percentage down, because everyone was allowed to take a test, whether they was in contact with someone, if they had symptoms. Anyone and everyone could take the test. Vast majority of them would test negative, driving the infectious rate down. So they did all of that for today. So the governor could make his announcement today, even though people are dying in Hawaii right now, even though our numbers we have not gotten a hold of our numbers. They went back up again, back to triple digits again today in the state. But do you think that stopped or slowed him down from opening up the tourism? Absolutely not. In fact, he's moving forward on tourism, but he's still keeping the local residents stuck in quarantine with no date of even suggesting that might be released. So it pisses me off, because I think that was always the plan. Always the plan. And well, he got his objective, he got his goal, but this is what is going to happen. And I'll stop here, because I'm getting angry again. But this is what will happen. It's my prediction. You've never seen me angry, Val, so I kind of embarrassed.
Yeah. Oh, yeah.
In about 3 weeks or 4 weeks after we open up the trans-Pacific flights, we will see numbers like we've never seen. And we're going to have to shut down again. We never even get a hold of our statewide numbers yet. And we're going to bring in potentially carriers of the virus. I support the tourism, but we had an opportunity to vet out this system of testing with the inter-island travel. So I could go see you, Val, without having to quarantine. You would die if I had to stay in your house for 14 days. But the tourists can come and take a test and go straight through and go all over the Big Island. But we cannot even go see our friends and family. That is going to create, I believe it's going to create an increase in numbers, forcing the state to shut down one more time. And that is the last thing we need right now.
Yeah,
and you and I both know that.
I think that the state should have been focusing on what Charlie had brought up about the tinting business. We need to start working with our small businesses that our local people need to utilize their services and build the economy up that way, and then start working with the farmers so that they can start growing food, so that when Matson or Young Brothers, whoever brings in, they don't have to bring in as much. And now the cost is going to be a lot higher bringing them in, because their costs, the shipping cost has risen. But we need to start looking at how do we build our economy and how do we live within our own means within each community. Should bridges go down, things happen that can we in each Ahupua'a district from the mountain to the sea, can we survive in that Ahupua'a without any help from the outside? And we need to build that type of sustainability. But to me, that's not tourism first. It's small local businesses first and people first, our farmers, our ranchers. We need to make sure that we're building the economy in a way that our people can live, we can sustain ourselves without having to depend on tourism. And it's a perfect time to do that, because why would you want to bring in more of that disease? Haven't we learned from what had happened? We had to shut down, but now you want to open up again, but you didn't even take care of our local small businesses that depend on our local residents to support them. I'm not looking at, and I feel sorry for the ones that are, in Waikiki, where you just rely on tourism to support your business. But a lot of those are mainland ABC company, big mainland companies. But so I agree with, well, I don't know if anybody said they agree with not having the governor open up tourism at this point yet. We need to work on building the economy from our grassroots first. That's my thought.
No, I firmly agree. But I think where the governor is really missing the point is all about the safety aspect. Because the safety aspect will trickle on to other things. Like, and I was going to ask you about, your thoughts about the DOE. We talk so much about opening up. Okay, if you're going to decide to open up, then why not do a two-test system? Because we can catch it on the front end as well as the back end. Because if what he talked about today, you take 72 hours or less, right? You take a test, you come back negative. What about a day before you catch your flight? You already got your results. Your results has been sent to Hawaii. But you ready to go to the airport, you stop off, go pick up some last minute provisions, and you come in contact with somebody that has the virus. So now we know it takes a period of time to incubate. And usually they talk about a 5-day window. That's why they talk about after landing, 5 days out, take another test to just make sure you never catch anything along the way. But not to even have that. So one, we neglect safety on that aspect. Two, a question was brought up, and I was going to ask your take on this, but I wanted to preface it by saying, we got our schools, our poor kids, many of them was thrusted into, some parents said our kids are smart. Sure, they're smart, but they're smart playing games on a computer. But now you're going to have them articulate in such ways that it's going to be focused on lesson plans. That's different. So when you start targeting that, one, were the kids taught enough to get them by? Two, you're relying on homeschooling when you're doing it at home, and the kids run into a problem and cannot ask the teacher. They're going to probably ask mommy or daddy. Now, is mommy or daddy proficient on the computer? Then we got a problem there. Three, you get a lot of plexiglass shields. And so I asked the question, gee, did anybody bring a doctor or a safety team to look at each campus? Because I don't think all campuses are the same. Did they analyze that, yes, plexiglass will work in this here? Because we know that droplets fall. You got plexiglass around here, teachers walking by, sure, they got their mask. But what about droplets falling behind the plexi shield into where the kids are? Did anybody address that? So these are a lot of unanswered things that's going on right now. That's kind of bothering me about how the governor intends to open up the state, because it almost seems like nobody has a safety team. I mean, you can ask Oogie this. You get on a SWAT team, they're going to serve on warrant. They're going to make sure they're doing their damn homework on the place they're going to serve, because if not, they're going to get killed.
Right.
I don't know if this governor has ever surveyed the problems that's on the plate right now enough that he can open with confidence. Because number one, to open with confidence, you got to get the confidence of the people. Right now, the people of Hawaii not can even trust him. So what confidence you going by? If you only get one team that surrounds you day in, day out in your office there at the legislature, that is not the state of Hawaii. That's just a group of people that you work with.
Right.
So that's why I wanted to ask you the question about schools. How do you feel about the schools at this point?
Yeah, I don't feel that it's safe right now. And like what you had said about coming in to do an assessment to see if all of the, uh, safety measures are in place. Did they assess each school to make sure that all the protocols and the equipment and safety equipment um, are in place? I'm sure not.
Mm-hmm.
I didn't hear that they did that. It's like the you that our veterans home,
Yukio, Otsuko,
uh, you
Utsu.
know, they had brought in a team, a team. I don't know if it's the Veterans Administration, a federal team down to look at the procedures, the processes, protocols, or whatever they had in place that they needed to, make changes to. And I heard they had to make changes to it. But I think on the very onset, exactly what you're saying, we need to make those assessments prior to opening up. Because when we do open up, then it's too late to go back. Yeah. But to come and do the assessments prior to opening up. But um, I don't know what kind of team they put together. I'm the thing that I'm real worried about right now too that we're going to run into is we're coming into hurricane season. Okay, so when we talk about disaster preparedness, we're not prepared with what we have already, right? We're going to go into disaster preparedness. Now, if there should be a hurricane coming and people need to evacuate, does everybody go to one center? Or are we taking kupuna who are vulnerable and have underlying conditions, and not even just kupuna, but anybody with underlying conditions? Do they have special evacuation areas for them? Where do we put people who are being tested that have COVID and are recovering at home? Where do they go if they're not ready to be in the hospital and have, it's not that their condition is not that bad that they have to stay home and try to get better. In the evacuation process, what happens? Where do they go? So where does Kupuna go? Are we ready for an evacuation with COVID and a disaster with COVID? When I went to our civil defense, when COVID first, I think it was in March when everything started happening, February, March, we weren't prepared. We're not prepared for disaster preparedness. All of what they have doesn't include this new pandemic. So there's so much that I'm so concerned about and the direction we're moving in and bringing tourists in and opening it up at a time where we're just going to get into hurricane season. Isn't it October, November? I think it's hurricane season.
Well,
Something
yeah, no,
like
it
that.
started
Yeah.
in August, I believe, and it goes all
Yeah,
the way through November. Yeah.
November,
So
yeah.
we're not even halfway.
Right. So when the governor is making these kind of decisions, is he also taking into consideration, the disaster preparedness issues as well? You got to take into consideration a lot of things because opening up and we have tourism full blown going full blast and a disaster happens and we don't have those things in place. Now we have more people to handle besides just our local people. We have a lot of tourism or the tourists that we have to take care of as well. But I don't know. I feel that communities need to take action themselves in how we prepare in our own communities. We're waiting for the governor to make all these decisions and all, but I think community associations or whatever organizations in that community that can help to take control of what happens in their own community. I don't know if that has happened in other areas on Kauai itself, or, you know, I'm looking at even in Ocala. What do we do? You know, we can be we're isolated in some areas. The DOH is not helping us because they're not even counting our numbers. We are gray on the map, you know, so we need to start taking care of ourselves because government isn't going to take care of us, you know. So I'm concerned about that, and I don't know what direction to go in at this point, you know.
Charlie and I have been saying this for months now, that we cannot rely on government. We know that. We know they have proven in every facet of this pandemic, they have failed. You know, and I hate having to say this every night, but we have a different guest every night. So I know the viewers probably get sick and tired of hearing us say this, but we have a different guest every night, and we share. But we have been saying that for a long time, that we got to take individual responsibility, our personal responsibility. Business got to take personal responsibility. Kauai, we're blessed. You know, Derek took some hard action early on. I believe that had a lot to do with our success. But I think we also have a lot of people here that follow the rules. And so we for the most part, we're open. You know, everything's open. Yeah, you know, I mean, you can go have dinner, you can go sit down in a restaurant, practice all that social distancing. But not everybody's like that. Not every business is like that. People abuse that. People take advantage, and that creates problems, especially on Oahu. But as it relates to schools, the DOE, I think, made a mistake when they left it up to each principal to deal with their individual school. Like Charlie said, every single school structurally is different. I mean, I'm talking physical structure, meaning the buildings, their organizational structure is different. So like the businesses, right? It should be, if the principal or your school can operate in a safe manner, if you have the space, if you have the personnel, if you have the policies and protocols in place where you can assure the safety of the teachers and the students, like the private schools are open. No, we don't see no COVID cases in the private schools here on Kauai. My point is that you cannot throw out these blanket policies because every single entity is different and they operate differently. So, you know, to leave it up to a principal whose expertise is in education and administration, like Charlie said, where's the safety team? Who do you have on your safety team to go in and make sure that your employees and your students and staff will be safe? No, DOE was so happy and no, we're leaving it up to the principals. And every principal has a different opinion whether or not schools should be open or online or whatever it is, right? No standardization, no consistency, just kick the ball down the road and see where it stops. And because of that, now we have all kinds of confusion. We have all kinds of problems. We have, you know, when we open up tourism, a lot of our families, and I know probably for you guys too in a Big Island, a lot of our families are hotel industry people. Right now they're home and they're able to homeschool the kids and make sure that they get on the computer and log on. But when you open up the tourism, we got to deal with the potential increase in cases. What are these families going to do that now they no longer will be at home to deal with their children to go to school? See, you know, 7 months ago when this started, that's when those discussions should have been had. That's when the experts should have been. We talk about this all the time: plan A, plan B, plan C. We never got a plan A. It seems like this guy is pulling stuff out of his okole every single day. When the pressure comes on, I'll tell you something. Derek came up with this bubble concept with any hotel on Kauai that was willing to follow the rules and be responsible for their visitors as a quarantine hotel. They would allow it, and they still would have to quarantine, but they would be confined to the hotel property. And the governor signed that yesterday. The governor signed that yesterday, And then today he comes up with this thing basically saying your bubble program just burst because we're gonna lift the quarantine. What is he afraid that Derek going to upstage him? That in fact people going to say, "Wow, that's a brilliant idea, Derek." The
No,
governor no can have that happen, right? Because the governor has done nothing in the last 7 months.
I
Well,
bet you this is what the governor going to say to answer that question. When you remind him that he already signed into order Derek's plan, he gonna come back and tell you, "Did I sign it? Oh, I forgot."
but I'm wondering if he's meeting with the unions because I know the hotel unions. My brother-in-law is on the safety committee, and the unions are meeting. I don't know on a weekly basis. I know, and maybe every other day. I don't know, but I know on a weekly basis, definitely, on planning on how they will set up their processes as union employees to be safe if they open up the hotels. So I'm wondering, even if the governor had the decency to meet with this unions to see what their safety plan of action is, so that when he makes his decision, it's a decision based on a lot of information that he got for the safety of the employees of that hotel. So I don't know if that's happening either, but
Well, there's two things that I kind of wonder, and I shared this before some time ago. In fact, we had Eric Gill on with us. I mean, that guy was he's an interesting character, but he said what he had to say, and he's right. He represents his membership. The question is whether or not the employees are getting the right training to deal with COVID.
right.
But even like right now, some people will say, "Hey, you know what? I know so and so came in contact, and I came in contact with so and so." A lot of these people got to be trained. You got to know what is first level contact, second level contact, and what are the procedures that you take. Not all second level contacts are going to be tested. We know that because they're considered distant from the COVID carrier, the original. Usually it's the first level contact, depending on how symptoms arise, they don't arise. But then you throw into the mix asymptomatics, probably more than not, because before was 40%. I can say right now with certainty, and Mel, you said it the last time, we're looking at maybe 50 to 55% asymptomatics. So people are not, they're going to be looking at people. So the safety factor has to be whether they have it or not. You have to treat them as if they had it,
Yeah,
even
yeah,
if they don't show the symptoms. But when you do something like that in the hospitality industry, isn't it the opposite that you're supposed to move towards them and not away?
yeah,
See, those kind of things are going to be very detrimental right now on how these hotels and the standards are set up because you're going to have to address that.
right.
And the thing I wanted to say about the your thing about like not all the numbers being counted. What's really funny is we just went through census, and what did census tell us? Everybody gotta be counted. That's how we're gonna
Right,
determine how much federal funds you will get.
right.
So on one end, if they can come to your neighborhood and like they came several times, and we had two houses on our property. My wife and I already filled up the damn paper. The guys keep on knocking on the doors. They're like, we talked. I said, brother, you like talk to the guys in the back, not me. But I can tell you with certainty, these census takers are better than contact tracers because man, they won't come knocking on your door until they get an answer.
Yeah,
I think contact tracers should be census takers. They're doing a better job.
yeah,
But the thing is, it's funny how they require everybody. They're gonna blanket until they got all the dots in each
right.
district all covered. But yeah, when it comes to DOH and when it comes to your health and when it comes to life or death, they say, you under 1,000, we can let that go for now.
No.
No.
Yeah,
The
yeah,
when Eric Gill was on, and he's with the uh, Unite. What is that called? Unite
Yeah, United HRE here, five.
Unite here or whatever. Anyway,
Yeah, hotel
they're
workers.
one of the two unions for hotel workers. their concern was, of course, they represent their workers. They want to go back to work, but their major concern was, are these hotels in a position to be able to offer the PPEs, the
Right.
testing, the
Right.
sanitization? That is the most important deal if you're gonna start bringing in people from the mainland that's gonna come and go off on your property. So yes, they the unions are very cognizant of that. We do have non-union hotels. As far as the bubble for Kauai, Timbers Resort is one of the hotels or the resorts that will be participating, and he'll be on Friday. For those of you that have been talking about the lieutenant governor, he'll be on tomorrow night.
Okay.
So we'll ask him the questions that you folks have been posting. But it's really comes down to, like the schools, can you operate, and businesses, can you operate in a manner that is safe for not only your customers or your students, but your staff and your employees? That's it, right? And if you can, then you should operate. If you cannot,
Right.
then you don't. That it's break it down to something very simple, and everybody can understand that, and businesses and schools or whatever understands that, these are, and you got the CDC guidelines that are minimum. If
Right.
I'm the principal or if I'm a business owner, I'm going to take it a step further, make sure that no one gets sick in my place, and that's what we all got to do. But this governor, he, I don't know if he's a gambler. I'm not sure if he's seriously, I'm not sure if he's a craps player when he goes to Vegas. But when you're playing with your money, do what you want. When you're playing with your own what you own, do what you want. You want to throw it away on a crap table, go for it. But when you're dealing with people's livelihoods and people's
Right.
lives,
Right.
then you best think about these things and get the right people around you.
Right.
And that,
And
I
you
think,
know,
is
I liked when they had opened, allowed the businesses to open. And if people were uncomfortable and saw that some of the businesses weren't following the CDC guidelines, then they were told to call civil defense and have that reported. Then civil defense would go out and check that business and see if they can still remain open, or not. And it's like the restaurants when the Department of Health would go and check and give them a placard to put on their thing that they got inspected and it's safe here, or they have I forget what the color codes was for the placards on the restaurants, but that's what we should be doing with the businesses, allowing our small businesses to open, having them take the proper precautions, follow the CDC guidelines, and have a way and have them all post on their windows that if they feel we're not that we feel as the public they're not following the CDC guidelines, here is a number to call to report us. So I think we need to start opening our local businesses, that if I need my car detailed like I do, I want to be able to take them to a detail shop and have it done, drop it off, and all. It's being closed is not going to do us any good. If they would follow the CDC guidelines, it would help them out and it would help us out too. But I think we need to start building the economy from the grassroots level up.
You know
For
what's been we shared this the other night with Tommy Silva from TNT, and we said, hey, if restaurants can have a placard system, why not we have a placard system for COVID? Either you get on green placard, that means that your businesses have been inspected and they will
right,
cover every single safety precaution needed to
right,
encounter customers. And if it's not, you get a red placard, and until such time you implement safety protocol, you cannot open.
right,
I think that would suffice at that point already. But what makes things hard too is a lot of the terminology, and we said this from a long time ago. Both Mel and I kept on pounding this. The mistake that the state made from the get go has been its messaging, not getting the proper message out. When you talk about essential, why is it you got two businesses that are essential, but one can stay open and one cannot? We
right,
talk about the mom and pops, right? They provide essential services. They
right,
cannot open. But yet you can have on Costco or on Walgreens, and yet the rules are there essential because they have a pharmacy. Okay, why didn't you tape off an area that people can go in and go straight to the pharmacy? No, they let them walk every place else but buy
Right.
jumper cables or buy whatever. Is that essential? No, it's not essential. But it was the definition and how it was used, and nobody's policing that. So for any of these plans to work, you got to get on good enforcement program to
Right.
keep everybody in order. Because if not, you get chaos, and that's when chaos is going to rule. Then Derek had warned us. You guys that keep on fooling around, I'll clip it, right, Mel? He told us he'll clip it. He'll take it away from us. So we learned our lesson. Hey, no fool around. Honolulu never learned their lesson. So
Exactly.
what happens? Honolulu defaults, and guess what? The entire states get penalized.
Right.
So we said, with all that surge testing, why did you not go into those areas that had the most infections and target those areas until you know for certain the infection rate is either secured in that area or it has spread beyond those boundaries? They
Mhm.
never did that. They wanted to do the search testing. And what did the search testing show us? That based on all these tests, we only found this much, and that was it. Thank you. And everybody clapped their hands. But how does it apply to areas like Waipahu, Wahiwa? You know, and I said this: if you're gonna have a breakout, say in Waianae, why you close all the way down Hawaii Kai for? Concentrate on Waianae and try to get them under control.
Right.
So then we talked about the contact tracers and being ex-cops. We only know that, hey, if I'm gonna look at one suspect, I'm gonna talk to one person. That person gonna lead me to another person. Sooner or later, we're gonna come all the way back to the guilty party, someplace around there. These guys, if you just talk to one person and they tell you another person and say, "Well, we got enough, we stop." I said, "Wait a minute now. Do you know where the origin of the virus came from? Do you know what person passed it on to this person? Nobody knows." And the thing that even frustrates me more when they had the airlines and those uh, gyms that got infected and was related to the airlines. With the airlines, nobody knows if the virus is going from the employees to the traveler or coming from the traveler to the employee.
Right.
Nobody knows because nobody asked where the thing went start. And that's the difficulty with this whole thing right now. That's the
Right.
difficulty.
Yeah. I think it's like really out of control at this point. Yeah, I'm just kind of really worried about our hospitals and what
Yep.
we can handle. You know,
Hmm.
uh, I'm so sad for the veterans because of all people that had suffered the most and had given of themselves, for our country, and what did we do for them? How did we
Killed
help?
them.
We
We
couldn't
killed
even
them.
help them. Yeah,
We
it was
killed them.
like
That's what we did. We killed them. That's what we did. We killed them.
they should have been our priority. You know,
Yep.
they fought for our country. They gave of themselves, and this
Did,
is
did, did you hear what the Avalon spokesperson said a couple of days ago?
what
That
did you?
she said they're following the CDC guidelines, but the very first time they said that they did not have certain things in place, but they manage many centers across the nation. So I was telling Mel today, I just went and looked that up. Just to take two, you take the Yukio Center, and
Mhm.
you take the one in San Andreas in California, both managed by Avalon. Both get deaths. Then you take the one in Hawaii, you got the one in Kalihi Valley, they had a recorded death. Then you can take Halenani, they get recorded deaths. When they say that they didn't have really a plan because of this pandemic, I'm thinking you folks had enough time knowing because the deaths in California happened back in July. Okay?
Oy,
Yeah, this is the one. This is, you have some that's happening back in July even before these. So what
wow.
I'm saying is, no tell us that you never have a plan when you guys are already experiencing deaths.
Employees, Evelyn. Yeah, right. Yeah, and it's so sad that
They're the
they
same ones managing you guys. You guys are senior veterans home.
Right.
Same company.
You know,
Yeah.
if if they were following the CDC guidelines, even the minimum, those people would be alive today.
Yep.
Right.
Um, PP, it's a corporate. Apparently, when you read the articles of Avalon and other places that are going through the same thing, it's quite clear that they are very. That article says nonchalant about the usage of PPE, and that's what does it. That's you gotta. I mean, it just I get so angry when I hear about unnecessary suffering and death, like you said, especially for our veterans. That's just and their families. Their families, they're in there to be taken care of.
Mm-hmm.
They're not leaving. I mean, they're leaving in a bag, and that's I hate to be so blunt, but that's where it's at. What is I know your mayor, he blew a gasket a couple of days ago, 3 days ago, whatever. He's calling for the removal of the management and so
Right.
forth. But what is the Big Island doing in the way of the virus? As far as you guys have quarantine checks, is your police and do you have National Guard that's going to homes to make sure people are
No, no, no. You have the Hawaii tourism is
Authority.
they're the ones are assigned to calling and I know they did because my daughter had to come home for uh, to remove some stuff from a container to move it out, and so she called Department of Transportation and asked if she could be here to do that. They told her you have to quarantine for 14 days on that site, and you could move from your her father's location to the site of where she has to uh, do the loading and then back, and that's it. And I know they checked because they called her twice when she was down at where the containers were, and then I think on the day she was leaving and to tell her that her quarantine was lifted, but she was already going back. But so I know that on our island, I had firsthand experience them checking in on people who were supposed to be quarantined. So that's a good thing.
but only with a phone call.
Only with a phone call though. But then,
Yeah. So if your daughter was at Costco or Walmart.
exactly, yeah.
Yeah. See, on Kauai, what they do, and that's why I say I got to give our island a lot of credit. And the police department and the mayor came together and agreed that we're going to spend this CARES money, and we're going. So every day they get the quarantine list,
Uh huh.
and they dispatch these strike teams that go. I hate to call them that, but that's what they are. And they get the list, and they go every quarantine address,
Wow.
and they check. That's what they do.
That
And
that is the right way to do it because
and look at our numbers. Look at our numbers.
right, because like you
Yeah.
said, she could have been shopping somewhere and say, yes, I'm at home and or whatever,
Yeah, I
and
know. I was talking to one of the Kauai Visitors Bureau employees that actually that's what they do. They call, and that's a good thing that they call. But you're not catching the bad ones.
right,
And again, statewide has to be consistent. And
right.
again, I
And
I
I'm
say
wondering,
this all
I'm
comes out of
wondering if I'm wondering if they can require the people who are in quarantine and have their cell phones to allow them to have the GPS available to them so that when they call, they can actually see where they're at.
well, they of course we know the technology is there. No one, the attorney general doesn't think it's constitutional. But for the bubble technology on Kauai, that they're that each guest will have to wear a bracelet that is it's a special bracelet that has a GPS tracker that
Uh-huh.
the hotel will monitor when they leave the geo fence of the property. The hotel is notified electronically, and they contact KPD. So those guys will not be able to leave the geo fence of the property that's been designated for the quarantine visitors. So the technology is there, Val, and that's I think what frustrates me the
And
most
I
is
think
that
it takes a good mayor like your mayor working with the community and the people to buy into what his plans are, and it's working. I mean, Kauai is such a good model.
Exactly. So, and that's why I don't get it. Like, it's okay to copy. It's okay to copy. And just, I always say, if you want the numbers that Kawhi has, then you got to do what Kawhi did.
Mhm.
And yeah, initially people were very pissed off, but now everyone is thankful that we had a curfew.
Yeah,
We're the only island had a curfew. Honolulu did it for
I
one
remember
weekend,
that.
and we had a curfew, 9 till 5 every night. That was unbelievable. Not everybody was happy, but I think it set the tone for us that hey, this stuff is serious. Charlie wasn't happy.
No, but I said, I mean, my post, I was dropping the f bombs and everything, but I was the first one to apologize and said I was wrong. It worked, and so
It
I was
worked.
happy after that. I was
Yeah.
happy after that.
I
Yeah.
was texting Derek. I remember texting him and talking to him about how proud I was of what he was doing, and wish that I could have been living on his island because he was doing all the right things. And it was, he made sure at the very beginning that whole lockdown and very strict happened, and people complied because they knew that enforcement was there because you set it up properly. I was hoping all the other islands would follow suit, but
But
we'll
you,
wait.
you know what Derek did? Derek surrounded himself with very good, intelligent people, and he allowed them to help in the discussion, and he had the balls to make the call. That
Yeah,
that's that plain and simple, nitty gritty, and whether or not the people was going to be happy or not, and that's what happened, and I think that's why we're where we're at today.
and his
And
priority was saving lives.
absolutely,
You know what I
absolutely.
mean? His priority was saving lives. His priority wasn't, oh my gosh, the tourism. We're gonna lose out on our economy or whatever. His first thing was, I need to save lives. So hats off to him, and hats off to Kauai and all that. Mel, you and Charlie, the communication. We talked about how the lack of communication is a big problem. So I think with what's happening here, with what you do for the people of not only Kauai, because when the woman who texted me saying, hey, what happened? The park had a lot of kids in it. They're playing soccer, blah, 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 blah. And she goes, hey, by the way, I heard you're going to be on the Mel and Charlie show, and that it's not just for Kauai because our Hawaii island watches it all the time. So what you're doing is you're bringing that communication, because we're not waiting for government to take action. You guys are taking action, and that's what we need. We need more people like you guys to start taking action in our own communities, and protecting our communities if we feel government isn't doing enough.
The sad thing is, and we're gonna keep on doing it, even though it's sad. We will go to the ends of the earth. One day, one of our good friends was just saying, "Hey, HMSA had this article about one Hawaii boy who's now the premier vaccine expert, and he's the director of the International Vaccine Institute in South Korea, and he went to Iolani." And I go, "Oh yeah." So we just took a chance. We went on Messenger on Facebook. Messenger guy said, "Hey, would you be willing?" And he said, "Yeah." So he was the one that came and talked to us because there was always this question. We asked him how his vaccines developed. Then Mel asked him the questions: how do we know that this virus wasn't man-made? And he took us through the whole steps of, because to find a vaccine, you have to alter the virus. And usually when you take a virus and you alter it, you leave like a fingerprint on it. That's how you can tell. If you don't see that fingerprint, it was never touched by man. So because he explained that, but see that kind of information, as far as confusing as it may be, the people loved it.
Yeah.
So that's our thing. We bring it out to them, we give the information to them, they use it good. If they don't use it, then we wait for another day, we bring on a different guest. So the next thing you know, we had this guest who was considered the angry doctor. Remember that lady, I guess she's from Trinidad, but she was saying about hydroxychloroquine. and she was on the front steps of the Congress, and the president was going to use her as a spokesperson, and she was going off. She was going on a tangent. Blah 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 blah. Blah. Well, on the Rachel Maddow show, had this guy from Arizona. They call him the Angry Doctor, Murtaza Akhtar, and he has a like a Indian dialect. And he went off and he called her wackadoodle and everything. So I told Mel, we go get this guy. He goes, you can find him. I go, yeah, I'll go try it. So I went online. I'm gonna look for him. I sent him an email. Sure. He like come on the show. So we had him on the show.
You guys had him on the show.
Yeah, we had him on the show. The Angry
And I just communicated with him yesterday. Was it yesterday, Charlie?
Yeah,
Or day before yesterday.
Yesterday.
He's coming back on. Him and Dr. Kim from South Korea will be on. Next week, we're doing candidate profiles for the county council race. But the week after that, we're going to have Dr. Akhtar and Dr. Kim from South Korea on. That guy is hilarious, you know. And, you know, our show is unedited. It's not scripted. And you can actually swear on our show. We haven't
boy,
sworn
did he
tonight,
swear.
which is, I had, you know, I mellowed out. I mellowed out after today's press conference. But yeah, we have a tendency. The other thing I forgot to tell you was that Hawaii News Now and I think KITV, they watch this every night. So don't be surprised you see yourself in a 5 o'clock news tomorrow, because they're going to take that quote, some quote you said, some shitty quote. Okay, I did swear. Some shitty quote that they're going to put on the news. I should have told you that before we went on.
Yeah, so it's such a different time that we're living in, and how life, what is the new normal? I don't know what the new normal is anymore, you know.
Well, you know, you've been a legislator for for a while. You've been in government for a while. You know, when you make laws, I think as you talk about communication and transparency, right? I was always taught from when I first started back in early 2000s was if you're gonna pass one law, you make sure there's a need for the law. You know, not just don't go pass a law because you can. Make sure there's a need that's going to benefit the bigger portion of the community. Number two, you have to be clear and concise, and you have to make it understandable. You cannot pass this highfalutin legalese crap that people don't understand. And then the third thing is it goes to what Charlie was saying earlier. It has to be enforceable, and you got to enforce it. You cannot just write law. So if you follow that, number one, again to Ige and his clan, do we have a need for these types of rules? Do we have a need? Yeah, absolutely. We have a need for several things, whether it's schools or visitors or whatever. The second thing is what you're trying to do clear and concise. BAP. The third thing, is it enforceable? BAP. In other words, that's shit law. So get away from that. Get away from it. Break it down. Break it down so it's easy, understandable, and enforceable, and we'll be okay. But they honestly, they're lost. They're in orbit.
You know why I'm laughing is because I'm thinking about Mayor Kurt Caldwell was so happy. He was so happy telling his rules. Yes, we're gonna put these rules about the beaches. We're gonna open the beaches, but only one at a time.
Oh no.
and then the first thing they ask, okay, but for our kids to be safe, we're gonna take the kids down to the beach. He goes, no, you're gonna get sighted. Everybody was going, what a stupid hit. So when I talked to Mel about this, he blew a gasket and I couldn't stop laughing.
Val.
Yes.
I can be with my wife in my house, and I cannot go with her to the beach or to the park. This is on Oahu, of course.
Yeah.
That's a double shit law. That's not just a shit law. That's a double shit law. When you can you can go Costco or Walmart, but you cannot, God forbid, you go to the park and go eat lunch on a picnic bench with your wife or your husband. No, you're gonna get a fine for $5,000. But you can go Costco and buy a $1.50 hot dog and soda and sit right next to her
Right.
in your car, coughing and sneezing all together. That's
Right.
perfectly fine.
And his excuse was, they asked him, why would you put out a law like that? He says, because law enforcement, they're going. Do you think they're gonna have a hard time telling between who's family and who's not family? So I said, my grandkids look just like my daughter-in-law, like my son. So I don't know how the hell you're not gonna know the difference.
And
Listen,
that's what people are getting. The public is frustrated about.
they passed the
Because,
frustration. Now they're pissed off.
yeah,
The frustration was 6 months ago. Now they're pissed off.
yeah,
Val, from as long back I can remember, as long back, and we all born and raised here. All the experts say, do not go in the water alone. Do not go hiking up the mountain alone.
right.
Do not go anywhere alone. Be with somebody. Be safe. Make sure you're safe. Don't. And here comes Caldwell. You better be alone. You better be alone, or you're gonna get a $5,000 fine. And we Caldwell is my friend, Val. You know that we worked a lot
Yeah.
together with him, and with EJ too. I tell people we had dinner with EJ and his wife many times, my wife and and I don't know what got into him.
Yeah.
I don't know what got into him.
Well, you gotta figure that their expertise is not preparing not in the healthcare field or in preparation of pandemics and stuff. CDC, you have people who are qualified experts that should be doing this. So they should be the ones surrounding him. And you keep laughing, but
No. I laughing
No,
because he laughing.
no.
But Val,
Everything you
Charlie and I
say,
not experts in anything.
no.
I
But what
know
you
that. But
say,
what I'm saying is the governor is making the decisions. That's why at one time I wanted it to be Lieutenant Josh Green in
yeah,
charge of this whole pandemic because it's his profession. He
yep.
has expertise.
And
You
he
know?
was. He was in charge. He was the guy. He was the COVID guy. And then he came on our show. Bam.
They took him off.
Yeah. No, I know. I know.
General Hara came on our show the very next morning. Bam.
They took
Yeah,
him off.
General Hara and Lieutenant Josh Green, I trusted them.
That's the
I
two
trusted
that
them.
should be running the show.
But
Yeah.
here's the thing:
Exactly.
we brought those two on. They got taken off. The only two we couldn't get on, they kept them, and that was Bruce Anderson and Sarah Bach.
Oh,
They declined our request.
Yeah, they declined.
So did
Oh,
Caldwell. So did Victorino. So we're honored that you came on tonight. Now, don't be surprised you go work tomorrow and you see your office was moved to the basement. Harry Kim gonna have conniptions.
yeah,
but
but
I wanted to say this about the other night with Heidi Sunioshi, she had bad connection, but I was able to get in a question through Mel, and the question was this: does Mayor Caldwell, and I pertain to Mayor, and basically I was pertaining to Ige too, does any of them have anyone that owns a small business that's on their staff? Because I think if they did, their thought process, the decision makers in their little junta would probably be a little different if they had somebody that had a small business background. They would see the frustrations because look at these restaurants that was given the green light to open, right? They're given the green light to open, boom, they order all this inventory. And in 2 weeks later, boom, shut down. Now, what do you do with all this inventory? It's crazy.
right. Yeah, we need to start working with our small local businesses, grassroots. We need to start working with our farmers, our ranchers. We need to start building the economy within our own Ahupua'a systems, within our own communities. And, we need to survive that way and then talk about how do we bring in tourism when it's safe and how do we do it. And I like what Kauai is doing. I think we need to follow suit on that. And I think Kauai has a great model, and especially this show too. This show is what gives people the information they need, and not only what they need, what they really want to hear, you know, and they need to hear the honest truth. You know, so even if you have to swear, Mel, because you're upset, I think that's what they like. In fact, Mel, once you posted this long Facebook video post and it was going viral, and then people were going, "Who? What was that guy? Oh, the guy. I think his name is Mel." And you know, so know that information that you guys are giving is important for the public because they feel that somebody's listening to them, you know, about their concerns and their fears.
And that's
Well,
what we
you
try
know,
to do. I mean,
Mel,
that's just what we try to do.
for our viewers out there, this is Mel Raposo, former council member from Kauai County. I know
Also,
I saw some of you printing. Is this Mel from Mel's Market in Waimanalo? No, this is not the Mel. This is this is not Mel from Mel's Market. This is
Yeah,
Kauai
I tell you
County
a
Mel.
quick story. Um, Val, you was a council chair at the time. We went to Honolulu for go fight for our
you and I were
TAT.
chair. Yeah, we got blasted that time.
Yeah, we got shredded, and but so I went up first, and the bell went off in 2 minutes. So we made a whole issue, and I anyway, I'm not gonna get into the video, but I did say I came all the way from Kauai, and you're gonna actually cut me off at 2 minutes. And he said, yeah. So my bell didn't go off, but I kept on talking. And that thing turned out into another viral video on YouTube. And then Val came up. Val came up and she started talking and her bell went off. And they stopped her. And she said, you're not stopping me with that bell. Why is that bell still ringing? Why is that bell still ringing? Bell was up there for, your time is up, ma'am. Your time is up. I don't, stop ringing that bell. She telling us. Stop.
Because they turned it off for Mel, but when I came up to speak, they didn't want to turn it off for me. So what I did was talk over the bell.
I tell you, if you guys want to watch that, that video, I think I have it on my YouTube channel. It was you know,
the transit accommodation, the TAT. Remember?
Yeah. Me, you, and Mike White, Chair White from Maui went up, and we fought the losing battle.
Is that the one? Is that the one? Kyoho, whatever.
But we made up. We made up. I mean, we had a good chat last week, and we both regret the comments that we made. You know, I look at it like this, Val, and you know, Val and I have, you know, we've been all over the country. Val, for those of you that don't know, was very, very active in the health part of county government. She was in all the health, the national health committees at our national organization, and very outspoken as well, very intelligent. So I enjoy working with her. But you know, we fought hard, you know, for what we believed in, and you don't always win, but at least when you go home and at night you can sleep because you did your best.
Right. And what we did was we fought for the people. And what we did was we represented the people's voices and what the people wanted.
Exactly.
You know?
And that's what I told Jared when we spoke. I said, bro, I was fighting for my people on Kauai, and you was fighting for you was doing your job as a state senator. Was it a Senate? Was it a Senate or House? I forget what he was back then. House, I think, whatever. And I said, we were both warriors, and you know, that's power already. We move on now. Now we got a common enemy called COVID.
That's democracy. You fight for what you believe is the voice of the people. So,
Now I know the truth. You know, tonight earlier I had 2 bells went off, right? If you saw Mel, he went like that. Now you get PTSD from the bell.
The buzzer. Yeah.
The PTSD is from when Val went on there and when they rung her, and then I was thinking, oh no, Big Island Theater just came out.
But it's all good. We had to do what we had to do, you know, for the people, and even if you know, we made a difference. I think we made a difference because there are some compromises made later on down the road. You know, so
yeah, I mean that's just you know, but now EG paying us back.
Yeah.
and you know, it is what it is, you know. But I tell you what, um, I honestly believe that we are, and again, it's people like you, Val, that come on our show, like Lieutenant Governor Green, and whether we agree or disagree, it doesn't matter. We're getting information out to the public, but I believe that the people, our shows get 3, 4,000, 5,000, 6,000. Some we get one show. We had the OCCC guard
Donna,
the
Donna.
whistleblower,
Uh-huh.
over
Wow.
25,000 views today.
Wow.
As of last week, I didn't even check it this week. A lot of people are getting informed and educated with this show, and we just do it, and we're gonna continue to do it, and that's it. We if not for us, and when I say us, means all of us, the viewers included, and the guests. Where would the people get the info?
Right.
You watch yesterday. We made fun of this yesterday. I know we're going to be on the time, but we made fun of this yesterday, right? Ige, we will make an announcement tomorrow. Certainly, we're going to make an announcement tomorrow. Why? Why you got to wait till tomorrow? Just tell us today, right?
Yeah.
So you get one whole day. Everybody like, what are you going to say? I wonder what are you going to say? Well, I wonder if it's inner island. And then we got to wait till today. Like, what the hell is the secret?
You know what I told Mel? I told Mel, like when you're growing up, behind your ear might be a little bit hound, right? But
Yeah.
you still gonna dig them and smell them, right? You're gonna get the same results. I told Mel, I don't know why you wait. You're gonna get the same results. And he thought what's gonna be different. And when the thing gave the same result, he said, Charlie, you was right.
I don't know why. Why would it be different? Yeah, why? You know, if your battery dead in the car tonight, why would I think the car gonna start tomorrow? Patsy said because your wife would fix them. Well, I wish his wife would fix them, but
Yeah. Well,
anyway.
hopefully things will get better. I think if you know, General Hara would get back into it, and
Yep.
Lieutenant Josh Green. I think if the governor surrounds himself with them and use, you know, their expertise, I think things can turn out better. But he needs to be open to that, and I don't know what he's afraid of, with having both of them on board and in control. I felt comfortable when they were, and look, when they were kind of put to the side, look what happened. I mean,
All
things
the myths.
started to get totally out of control. So, uh,
Today the announcement with Green, Libby Char, because I worked with her before when I was at the ME's office, and I'll stand that lady is good. I think there'll be the health department will be in a good position, and having Ken Hara back at the helm as an incident the commander for Haima. I think if the governor just steps aside, let them do their job, and he checks in with them like once a week, and they update him. When brother come and talk, it's like, oh, everybody, hold on. He gonna say something that might just, and you can already tell, just by looking in his eyes. It's when you see his eyes almost closed and he ready for talk. It's like, oh, we'll get blasted now. And sure enough, he'll say stuff like that. When the news reporter asks him a question about where do you get the data, he actually comes out and tells you, we have no data. So how do you expect the people of Hawaii to feel when we take in your lead? It's like the blind lead the blind. You should have brought somebody on that had a little bit more common sense for answer differently. So that's what I always said about the messaging. If the messaging is not right now, more than ever, Governor Ige needs us to buy into his program. And because he spoke so many times with forked tongue, nobody wants to listen.
right.
And if that's the case, we in deep kimchi. We gotta be able to come on board and buy into the program. But yet he gives us no reason to buy into it. That's the problem. That's the problem.
Yeah. So it's going to be interesting. Tomorrow night is Lieutenant Josh Green.
Yep.
Yeah.
Yeah. So I'm going to tune
Hopefully,
in
he's
to that.
hopefully. I know he is experiencing some symptoms. Hopefully tomorrow he's feeling well enough to come on, and
Yeah.
we understand if he cannot, but
Yeah.
uh,
But, when he comes on, I think people have a feeling of calm. And I think people feel some hope. because listening to him, people trust him, and we need to hear from people that we trust at this point, and that brings a calm. So I'm looking forward to, hopefully he'll be on tomorrow night. I'll kind of tune in and see what happens. But yeah, I gotta again mahalo you too,
Thank you.
for, I don't know whose idea was this to start this program. You
EA
know,
asked me to do it back in October of 2018. He said, "Hey
right
Mel, can
now,
you do a show every week?" I just
I
said,
would
"Well,
love. You know who I would love for you guys to bring on?
who?"
Our former mayor Billy Kinoy.
We
I
tried.
asked Billy. He was actually very early on when we started this in the beginning, and he was just not ready to do a video. But he was the first guy I called, believe it
Oh,
or not.
because try again. I know Sherry Bracken was
Well, you
successful.
try. You go get him. You
Yeah,
better
okay.
looking than me. You go.
Yeah, because listening to him, I mean, you know, he too.
Yeah.
He's a,
No, Billy. We go back a long way, and
yeah, he's been through when he was mayor when the economy tanked, and he was there when the first lava disaster happened, and so there were things that he knew, that communication, and um, he just brought a lot of hope, to our people, and he did a lot of good,
yeah,
and we made it through.
Billy.
You know, so this is
Yeah.
something I would kind of be interesting to see. What would you do, Billy, in this situation? You know,
Ooh,
I would love to hear from him on that. Yeah, I'm
yeah,
gonna try and bug him. We'll see. Hopefully, he's listening in.
yeah. He might be. He comes on. I know that. I know that. Uh, yeah, he's definitely one of a kind. My best friend, man. He's a
Great
good guy.
leader. Yeah.
Yeah.
So
So
I think
anyway,
time is gone.
yeah. Any closing comments to? You got a lot of people on here from the Big Island and from throughout the state. And any
Yeah,
closing comments?
I would just encourage them to keep watching this show, and then reach out to any of us, any of the council members in your district. And if there's something that they want to hear, on your show, maybe ask us to contact you to, try and see if we could get other people on the show that would be of interest to them and in our community, and what kind of things do they need to hear about, with this pandemic, and what would they need, uh, so that we could move forward in the communities in a healthier way, where we can start to manage our small communities. It takes a village to raise a child, they say. So it
Mhm.
all takes all of us to make sure that we're gonna, uh, be a safe and healthy community. Because Department of Health ain't doing it right now. I mean, we're in the rural communities, we're the gray, we're the no data available people. So, we got to start taking action ourselves. But this program is one way for us to get some transparency and good information. So, I'm going to encourage our viewers to reach out to us so that we can, bring things to them on this program that would be very helpful for them. So thank you guys. You guys are
Oh,
awesome.
thanks. Thank you
Yeah,
for coming on tonight, Charlie.
yeah.
Well, I'd like to take this opportunity to thank our guests for tonight, Val. Thank you so much and for your insight. And it's just good to see you again. I will send a text over to my brother-in-law and let him know that I was hoping I believe he was watching tonight,
Oh,
but I hope
okay.
he, and Stephanie sends her love too.
Oh,
She's on tonight too. But to our viewers out there, mahalo again. I can't, me personally, I can't thank you enough. This journey has started with Mel and then him inviting me on. And, all of you have gone through that journey with me during the dark times when I lost my brother. And so I made it a vow to, I promise to always try to bring whatever information we can to help you, especially when government is not getting the information to you. And whatever information you use, use it. And what you can't use, you throw it on the side and we'll get some more information. But it's all about staying connected, keeping our communities connected. So
Right.
thank you out there. Thank you very much.
Aloha.
Thank you, Charles. Thanks, Val. Nice seeing you again after all these years. You know, in the military, I learned a long time ago: lead, follow, or get out of the way. And I think this goes out to all leaders. You got to do a self-assessment, man. If you're not leading and you're not following, then you need to get out of the way. Let the leaders lead. And that would be my message to all leaders, not any specific leader. Um, Unfortunately, I think we still got a long ways to go. And what we cannot allow to happen is this communities to fall apart, like you said, Val. Now is the time we gotta unite. We talk about Iniki on Kauai many years ago when everyone came together. We gotta have that mindset. We gotta get back to that mindset, and we need leaders to facilitate that, and that's what we gotta work on. And gosh, don't ever forget to stop praying. Keep on praying because we need God's help and wisdom as well. Tomorrow night we get Lieutenant Governor Josh Green, and I'm sure you guys have a lot of questions for him, as I do. Friday, Gary Moore from the Timbers Resort will be on to explain how his property would implement the bubble resort program if in fact it gets off the ground. And then Saturday, I don't know, we get anybody for Saturday? No, we don't want nobody for Saturday, so I don't
Yes,
know.
we have
Who?
um
Oh, Mel and
yeah,
Charlie,
we
she said.
no
No,
we
who
and
is it?
no
Oh
we
no,
have
I'm sorry.
yeah,
We get the Lifeguard Association. Believe it or not,
right.
we start Beach Safety Week next week. So, oh gosh, thanks, Charlie.
Yeah.
So yeah, we'll have representatives from the county and Kauai Lifeguard Association to do presentation. Please join us for that. And then next week, Monday, Tuesday, Thursday, Friday, and Saturday, candidate profiles with our local council candidates. So we're gonna take a little break from COVID. If anything pops up, obviously we'll have that discussion before or after the forum, but we'll have 3 candidates a night, 15 minutes each. So we get to learn a lot more about them, the last 14 candidates. Wednesday, they have another forum. So Wednesday, I'm trying to get Dr. Octor or Dr. Kim on for next week, Wednesday. So anyway, Power Pack Week this week, Power Pack Week next week. We hope you guys continue to join us. Val, again, thank you very much.
And thank you. And Mel, if you could like post it on your Facebook, what the schedule is so that we can, tune in on the nights that, would be interesting.
Every night is interesting.
I know it is. It is. But if there's a specific topic,
Yeah. Okay.
that people would want.
Will do. Will
Thank
do.
you.
I typically put up a post in the morning of our guest. And sometimes guests cancel. Sometimes we don't have a guest. So anyway, we do best we can, but we'll let you know, Val.
Okay, aloha.
Thank you.
Guys. Love you
Our
guys.
love to the Big Island. Huh?
Okay. I said I love you guys.
Yeah, I love you too, girl. Take care. Tell your husband I said hi.
Okay. Okay, take care.
You guys stay safe. God bless. We love you guys. See you guys
Aloha.
tomorrow night. Same time, same place. Aloha.